Good morning. Thank you very much for the introduction. Focusing on sexually transmitted infections in university students, and I'm supervised by Professor Sia and Professor Philippe. So globally, daily, almost more than 1 million sexually transmitted infections are acquired, and this is a significant part of the global burden of disease with an overwhelming impact. When you look into HIV, for example, as an example for sexually transmitted infections, about half of the incident cases are reported in the 15-24 years age group, and this makes this group the highest risk for STIs. And this is also the group from 15-year-olds who are in universities. So when you look into the university students, the complications would include missed classes, school dropouts, emotional distress, and other complications on reproductive health. When you talk of university students, this is a special group, sort of. They're transitioning from the parental supervision or teacher supervision into the society, trying to establish an independence or identity, and they're highly experimental into alcohol, substance abuse, and this may also increase their risk for STIs. But as they also fall into the adolescent category, reports have been shown that this group also has unsatisfactory access to healthcare. So there are issues of stigma around it. There are issues of you show up to the clinic and people would know what you've been up to because you have an STI. So it's sort of a silent epidemic. You get it silently and you suffer with it silently as well. And talking of university students, research that has been done in the sub-Saharan Africa has reported sexual activity prevalence at around 58%. But when you look into the challenges of doing research around such sensitive matters, this prevalence might actually be an understatement. And there are a number of first sexual encounters that have been reported at universities, to the point of some authors making statements such as university campuses being potential fertile breeding ground for HIV, and students actually conducting themselves as if the disease does not exist. So we felt there's a need to look into it because a number of research that has already been done has shown even though these students are perceived to be at a higher risk, this has not been fully evidenced within the community. Research has either been done to look into the knowledge and awareness level or risk perception or prevalence studies only. And when you look at the prevalence studies that has been done, they have looked at HIV prevalence from the general population. And the prevalence that was found in these studies was too low. The numbers were too low to make sense out of it. And then there are issues of awareness and misconception to risk of STIs among this group. But then research that has been done in universities that shown to actually have policies that around STIs such as HIV, this has been seen as a student issue. So the administration does not really take into consideration such STI-related issues. And this makes it difficult even for the students themselves to actually pick it up and do something about it. But at the core of it, this is a very mobile population. So students will travel from their home to the different campuses or lecturers as well. And for the case of Mbeya region, this is one of the regions in Tanzania with the highest HIV prevalence. It has the characteristics of a border town. It has 2 international borders, Malawi and Zambia. And so there's a lot of trade that is happening, which also factors into increased commercial sex work. And research around university students and communities has shown that the students actually prefer interactions with the community around as compared to interacting with their own student community. And so in a region like this, with all these dynamics, we wanted to see if this actually has any impact on the health, on the reproductive health of these students who are perceived to be at high risk. So the situation in Tanzania generally, it's good news that the HIV prevalence is declining, but there's evidence to suggest that incident cases are being reported among key and at-risk populations, and at-risk populations now include this group as well, as I introduced the topic. With the issues of awareness, using HIV as a proxy, after all the attention that it has been given, less than 50% of these young adults are said to have comprehensive knowledge. So you can imagine if this is HIV, with all the attention that it has, what about the other STIs, which actually have been shown to predispose one to HIV as well. There are issues of sexuality education. There's a curricula that is undertaken in secondary schools, but it has received a number of critics, and it's not really sure whether it is resourceful to equip these young people as they transition to the university setting or into the community now as being young independent adults. And so there are a number of factors, such as cultural factors, that we don't really talk about sexual and reproductive health matters within our families, within the school. So even the teachers don't find it easy to communicate to the students, and there are a number of issues also the students cannot ask their teachers. And on Tuesday we had a workshop on community and public engagement, and I remember Lillian asked, is your research addressing current lively government issues? And so yes, for this one there are a number of national surveys that have shown that sexual health still warrants attention, and there's a Tanzania Development Vision 2025 that has identified access to quality reproductive health services as a priority, and it needs special attention, especially when it comes to access to care by these young individuals, as well as the WHO Global Health Sector Strategy on STIs 2016-2021. So then this study would look into, first of all, the level of awareness and risk perception, as well as the practice of sexual behavior practices among these university students. But we also want to see how big of a problem is it. So what is the prevalence of STIs among this so-called at-risk group? So the study is divided into three main studies. Study number one would look into the awareness, sexual behavior practices, and access to care. If they what are their care-seeking practices, and if they've accessed care, what are the experiences, what are the gaps that they've seen in accessing sexual and reproductive health in the region. But we want to also couple this with biological markers, looking into the prevalence. As I mentioned before, that previous research has done either or. So here we want to couple this together, because reporting on sexual and reproductive health matters, collecting information just from the questionnaire might not really give a picture. So we want to also couple this with the prevalence to see how big of a problem it is. So we test herpes simplex virus type 2 infection, HIV, high-risk human papillomavirus, syphilis, chlamydia, gonorrhea in this population. And then the third study is looking into those who are infected with high-risk human papilloma subtypes, and if there are any pre-malignant cervical changes at this early stage as well. This will be a cross-sectional study using quantitative and qualitative data, so we'll have in-depth interviews as well as key informant interviews with the university administrations, and we aim to enroll young adults, 18 to 24-year-old, who are attending university or colleges in the region. Data collection will be through a self-administered questionnaire that will assess awareness, risk perception, access to care, and we also collect blood and genital samples to test the STIs that I mentioned. Progress so far from the last AGM, we've managed to secure ethical clearance as well as university registration, and I managed to engage the higher learning institution communities in Mbeya to get the permission, and also to have them on board to support the project. And this is also featured in the current Thrive newsletter that has been circulated. Data collection is ongoing. We are seeing a number of positive cases of herpes, chlamydia, as well as high-risk human papillomavirus, and mainly subtype 16 and 68. And the cases that have been seen positive for herpes are also positive for high-risk human papillomavirus. This is just to show that sexual activities do happen. We have, from this work, we have also been identified as a part of the regional sexual and reproductive health stakeholders. And just before I came to Kampala, we were invited to the regional sexual and reproductive health stakeholders meeting that addresses STI prevention in the region as well as teenage pregnancy. But I was also privileged to be invited to Peace Corps science workshops. So they usually have these yearly workshops for their students who have performed well in science subjects. So we're invited to talk about our career path using science and where we are right now. Supervising students, MD4 students at KC Muko, as well as mentoring master's students under the East African and Health Research Commission program for young East African research scientists. One of my supervisors has also introduced me to a group in South Africa from the National Institute for Communicable Diseases, working with the Division of National Health Laboratory Science, that is looking into Mycoplasma genitalium research. And so since we don't have enough funds for this project to do this, we are storing samples, and we are currently looking for funds and, to also undertake this work. We're currently drafting an MOA to work with this. In the next step, I aim to complete data collection, draft a manuscript, and also continue with the research enrichment, community and public engagement. And my focus for this is using adolescents to create interventions on sending out messages on sexual and reproductive health. There are a number of challenges that I'm facing. So first of all is the issue of getting participants, enrollment. The clinic visits sometimes clash with the university timetables, but also we had thought we'd move new technology and use ODK applied gadgets, but some of the students would come to the clinic and they would still prefer to use the hard copies questionnaire, so we'd have to actually do the data entry again. But so far we are proceeding well, and I would like to take this opportunity to thank my supervisors for the support, my fellow PhD fellows, and the funders for this work. Thank you.